Introducing Dr. Melissa Cohn, emergency medicine attending physician at Einstein Healthcare Network.
Hello, everyone. My topic's a little different, a little less heavy, and fewer puppy dogs. So sorry about that. But thank you for having me here today, and welcome all of you to ThinkFest. I'm an emergency medicine trained physician working at one of the busiest hospitals in Philadelphia. My colleagues and I, we have to be ready for whatever is going to be coming through the doors. And unfortunately, as also an emergency medical services physician, I have to be ready to go out to the scene for the things that aren't really ready to come through my doors. So we're going out there and trying to see what we can do for the patients in the field. I work at one of the 5 medical command hospitals in the city. It's Einstein Medical Center up in North Philadelphia. So you can assume that we're a fairly busy hospital in town. But by being one of the few emergency medicine trained physicians in the city in field amputations, my experience underneath a CSX train at around 4 o'clock in the morning was something that most people would consider unique. The concept of performing a procedure under a train that is typically performed in a sterile surgical environment, it's innovative to say the least. So the steps leading up to, before, and afterwards made for a combination of events that hopefully the city will never have to see again for another 20 years or so. I was woken up in the middle of the night around 3:15 in the morning and asked to amputate a man's leg. At first I thought maybe this was a prank phone call, one of my coworkers just trying to be funny, but no, this was a legit phone call. Most of you, or hopefully none of you, will actually have to receive this call either. But I gathered my bag, some tools, medications, and headed up to Northeast Philadelphia to crawl under a train. When I arrived there, it was pretty surreal. There were dozens of first responders standing out in a hot, humid end of summer night who had been waiting for me. Little old me, just my regular ER doctor, and with a bag of drugs and gear and a saw. So I crawled underneath the engine of the train where the man was trapped and assessed the situation there. I stepped back out for a few minutes. I collected the tools that I needed, some medications, and then crawled back underneath to really get things started. After we gave him some medication, we started the procedure, and it was over faster than I could have imagined. We were able to get him out fairly easily after we had done the procedure, and we took him off to the hospital, and en route kept doing just what we do. It's hot, humid, cramped space, and definitely something that I don't ever expect to be back in again. But it was definitely an experience I'll never forget. I've had some other bizarre and strange experiences. I unfortunately had been present at the Boston Marathon bombings. I regularly work the medical tent there. I have for years, and I was working the finish line medical tent when the bombs went off. Myself and some of the other first responders ran outside to start taking care of patients, and that instinct, all of that training, all of that work, all that experience you have leading up to it just goes right into effect. And you just start doing things. You put the tourniquets on the patients, you clear airways, you decide who needs to be transported out of there first. And that scene also happens so fast. I was back on the train headed to Philadelphia at around 6 o'clock. I got stopped in the Amtrak station heading down on the train, and when I got to 30th Street, I was still covered with bomb debris, and so the dogs stopped me to kind of check me out there, but still wearing bloodied clothes and some credentials. Thankfully, they kind of let me go. But it's, I didn't expect to have to apply tourniquets and apply pressure to stop bleeding. I didn't expect to get a 3 a.m. phone call to cut off a man's leg under a train. But that's what medicine's about. It's about taking care of patients. Whatever the situation's gonna be, that's what we're gonna do. We are trained for emergency medicine. Some of us are trained in a little bit more of a specialty, like I said, for emergency medical services, and you have to be ready to take on whatever is presented to you, whether you're sitting in the emergency department or it's that phone call that takes you out to the scene there. Emergency medicine's still a relatively new phase of medicine on the whole. We've made a lot of discoveries and innovations, and we have all sorts of fun tools. But sometimes all you need is a saw, or a torn up t-shirt to make a tourniquet on, you know, some young female who was just there to watch their friends run a race. You know, we've definitely conned with the concept of the whole purpose is to take care of the patient. We, you know, want to make it more about treating human beings. It's not just the medicine, it's all the things that go into it to be able to do the best thing that we can do to treat the patients. That's our job, and we are out there to try to make a difference. So thank you guys for having me today.